If you live with sickle cell, you might have heard of priapism, but what actually causes it? I'm Dr. Lewis Thomas. I'm a former doctor of 12 years turned sickle cell coach, and I live with sickle cell myself. Let me show you how priapism works with this balloon. So normally during an erection, blood flows into the penis, just like I'm pumping air into this balloon. And this can happen with sexual arousal, obviously, or it can just happen randomly out of the blue. And it tends to happen most often during sleep, which is completely normal for the body to do that. So as blood flows in, the penis gets firm, but just as important, the blood needs to flow back out again. That's like letting air out of this balloon. Yeah. So in sickle cell, the problem is on the way out. So because the red blood cells are rigid and sticky, they can get stuck in small vessels on the way out of the penis. And this traps the blood inside. So the blood is trapped inside by the sickled red blood cells. And that's like essentially tying the knot so that none of the blood can flow back out, just like none of the air can get back out of this balloon. So if this knot isn't untied by relieving the blockage of blood flow, then problems can occur. And this isn't just uncomfortable, it's severe pain. It's like the pain of a sickle cell crisis from the oxygen not getting to the tissue, but concentrated in a very small area, the erect penis. So if it lasts longer than 2 hours, it's an emergency because it can cause damage to the penis and lead to erectile dysfunction permanently. So if priapism happens, don't be embarrassed, just go straight to the emergency department and ask to see a urologist. All doctors should know that this is part of sickle cell and they can treat it to protect your future penile health. So I'll talk about treatment separately, but if you have any other questions, let me know in the comments, or if you want to share your experiences, then let me know as well.